It's estimated that women make up a third of those living with HIV in the UK, yet they remain overlooked in research, services and discussions. Gilead Sciences is committed to putting women at the centre of HIV by increasing awareness and ensuring equitable access to care and support for women living with or potentially impacted by HIV.
Women across the UK and globally are facing a crisis when it comes to accessing HIV prevention, testing and treatment services. Gilead Sciences, a HIV leader in development and innovation, say women face a gender inequality.
I think when we think of women specifically, the impression people get is, as a woman, maybe I'm not as impacted. Maybe I don't need to worry about HIV. And so the concept that women are left behind in being offered even the opportunity to understand that they could protect themselves against HIV, access to preventative services, access to testing, and access to service and care overall. So there is an important gap there around awareness of who could be impacted by HIV.
Gilead Sciences are working together with the HIV community to help reach 2030 goals and end new transmissions, with the firm belief this is possible in our lifetime. They say there are an increasing number of women testing positive for HIV, and this needs to be addressed. Over 100,000 people are living with HIV in the UK. Last year, 46% of individuals diagnosed in England were women. Currently, 1/3 of people living with HIV in the UK are women. Hi, Mercy.
Hello.
Mercy is one of them. She works as an advocate to help educate people about HIV.
I would say that women are too often overlooked. When we look at the global picture of HIV, the burden is carried by women, disproportionately affects young women particularly. But also I think it speaks to broader societal attitudes around women, sex, their bodies, and all of the things that come around the expectations of what it means to be a woman. We know that women are underrepresented in trials and research, and therefore innovations that are used kind of for general populations of people living with HIV might not meet and fulfill the needs that they have. So, women and the things that they'll go through in terms of pregnancy, menopause and other things to do with their bodies are not always factored in. And so that really leads to a lack of accessibility.
It's a fact that HIV can impact anyone, but there is a real call for action for women to be at the heart of the HIV conversation. Sophia's Forum, who work closely with Gilead, have been trying to influence policy around the issue. From research, they have identified a noted difference between men and women when accessing PrEP, medicine taken to prevent getting HIV.
HIV services historically have been modelled on gay men, and gay men are known to access sexual health services in a way that cisgendered and trans women don't. The positioning of PrEP when it first became available was targeted at gay and bisexual men, and that has driven the inequity of access and uptake in the UK thus far. There needs to be complete political will from government and the willingness to want to put women at the centre of the HIV response. There needs to be a complete reframing of the messaging. There needs to be complete representation of the people who can be affected by HIV, which fundamentally is everybody.
The women say it's time to put women at the centre of the conversation. Gilead say new innovations in treatment and care have come a long way, but there is much to do.
Medicines alone would not solve this. We need every single part of the whole response to be active and taken on their role. We need government. We need healthcare providers. We need scientific societies. We need members of the affected communities. We need the general public. We need other industry sectors to really everyone come together to help us in this fight against HIV and to be able to end the HIV epidemic.